Assalamualaikum warahmatullahi ta'ala wabarakatuh. Good day, students. So in this session, we will discuss the procedure on assessing the breast and axillae for the female. Unahin ko muna yung mga babae. Okay, so ano ba yung mga dapat nating malaman? Okay, and assessing the female breast. Okay, so the anatomy of the breast and axillae. So the female breast lies against the anterior thoracic wall extending from the clavicle and second rib down to the sixth rib from the sternum across the mid-axillary line. Its surface area is generally rectangular rather than round, no? Kala natin na ang surface area niya is round, hindi po. Pagkapain po niyo yan siya ng maayos, it is more on rectangular shape, no? The breast overlies the pectoralis major and at its inferior margin, the serratus anterior. Again, ito po ay mga review lang po ng anatomy ng ating female breast. So, ayan po yung isang suso po ng ating tayong mga babae. Okay, so makikita nyo po dyan. Ayan po yung mga lymph nodes and mga veins. So we have that subclavian vein, which is dito po sa area na to. And andyan dyan yung mga lymph nodes. Naka-attach yan siya dyan. Another dito ay ang axillary vein. And then may naka-attach din po mga lymph nodes dyan. Okay, we have here the gland tubules. Okay, the fats. Okay, kasi depende po yan kung mataba ka, then malaki yung dede mo. Pag medyo payat-payatin ka, maliit yung dede mo. Okay? And we have the serratus anterior dito sa baba. Ito po yung sinasabi nating serratus and ito po yung sinasabi nating pectoralis major. And then ito po yung ating areola, yung dark skin pigmented, dark na pigmentation dyan. And then dito is your nipple. Okay, so yan pong mga gland tubules, yan po yung nilalagyan ng mga gatas o milk ducts. Okay? So, describe first the clinical findings. The breast is often divided into 4 quadrants based on the horizontal and vertical lines crossing the nipple. So, sometimes we imagine we imagine that we divide the breast, okay, together, the same din pag dinidivide natin yung abdomen, dito din sa breast, dinidivide natin siya in 4 quadrants. And then yung pag-assess natin is clockwise, no? Para at least alam mo specifically. So dito may kita ninyo, andi dito yung tail, okay, we have the upper inner quadrant, lower inner quadrant, lower outer quadrant, and your upper outer quadrant. So, pag inner, meaning po dito is dito po sa area na closer po sa midline. Okay, this is the inner part. And then, pag malayo sa midline, that is your outer quadrant. Okay? So, an axillary tail of breast tissue extend towards the anterior axillary fold, alternatively localized as the time on the face of a clock and the distance in the centimeter from the nipple. So, kunwari, ito yung parang watch hand, okay, dito yung center, and then you imagine, when you assess, you imagine, okay, at 10 o'clock, okay, you imagine na ito po ay orasan. Para po pag may makapak po kayo ng mga cyst, okay, at the direction of 10, example, ito siya 12, okay, so at the direction of 1, okay, may nakapa po akong mass dito, 1 o'clock. Okay, so ini-imagine po para at least very specific ka anong area mo nakapa yung mass or cyst, no? So let's discuss the breast structures. Okay, so ito po yung ating breast structures. We have the smooth muscle, the nipple. Again, 'di ba? Misconception po actually ng mga yung mga ibang mga non-Muslim. I'm not referring to all, but some of them are showing their breast by just covering their nipple because they're thinking that yung nipple lang nila ang dede. No, the whole po is the whole po is dede po yun siya, no? And misconception feeling nila na ay okay lang, hindi naman nakita yung nipple ko. Hindi po yun na nipple po na yun na yung suso mo. Yung lahat po, kalahatan, yun po yung suso, no? So we have the duct opening, the areola, which is ito pong areola na to, yan pong dark na yan. Pag nagpapasuso po yung isang babae, kailangan po covered po yan or nasa buong bunganga po yan ng baby, no? And we have your sebaceous gland. Kasi hindi nyo mapapansin na pag hindi kayo kung hindi kayo nakakaligo everyday, paminsan, um, may medyo oily and ano to, nagiging ano to, nagsuswell din yung ating breast, lalo na pag mainit. Okay, so for the lymph nodes naman, it is very important na alam po natin because ito pong mga lymph nodes, especially breast cancer po, pwede po yung tumor is una pong tumubo sa lymph nodes. So, dahil marami po yung lymph nodes natin dito, so kailangan talaga ma-properly assess po natin. Again, most common area po kung saan nagsastart yung mga nodules, masses, is usually sa ating lymph nodes. So, lymphatics from most of the breast drain towards the axilla. The central nodes are palpable most frequently. They lie along the chest wall inside, usually high in the axilla, midway between the anterior and posterior axillary fold. So, andi dito po banda ang ating central. Makikita niyo po dito, ayan, no? Andi dito po, deep within. So, kailangan po yan siya na nakakapanyo yan. So, if ever may makita po kayo or may mapalpate po kayo dyan na medyo, ay parang matigas yung lymph nodes niya or movable. So, you have to check, no? The condition of the lymph nodes. So, ayan po, makikita nyo po yan, yung mga, lymph nodes. We have the lateral, dito po banda sa medyo itaas ng ating kilikili. The central, sa gitna. And then, we have the subscapular, dito sa posterior area. And then, we have the pectoral, dito sa harap ng medyo sa itaas ng ating dede. So, yan po yung mga kuan. And also, we have dito din, okay, makikita ninyo, your supraclavicular and your infraclavicular. Okay? So, pectoral nodes, sila naman po ay located located along the lower border of the pectoralis major. Kaya nga pectoral node. So, medyo kalapit siya ng ating pectoralis major na muscle, no, inside the anterior axillary fold, and these nodes drain into the anterior chest wall and much of the breast. For the subscapular, it is located posteriorly, located along the lateral border, sa side po ng border ng ating scapula. Dito po yung ating scapula, palpated deep in the posterior axillary fold. So they drain the posterior chest wall and a portion of the arm. And pag lateral naman po, dito po sa bandang itaas ng ating kepet, okay, so located along the upper humerus, and they drain most of the arm. Pag sabihin po natin, ano pa yung sabi nyo, ma'am, ano yung mga dinidrain? Remember po, yung, if you can still remember sa inyong lymphatic system, so yung lymph nodes po, meron pa po tayong tinatawag na lymphatic fluid, na every now and then, nagde-drain po yan siya on a certain areas of our body, kasi po, yung lymphatic fluid, nagdadala po yan ng mga lymphocytes, and these lymphocytes fights infection. Kaya po, pag yung mga lymph nodes ninyo is namamaga, there may be something wrong or infection na pinapatay po ng ating mga lymphocytes. Okay, so first po na ina-assess natin is health history. So you have to take, again po, pag main problem ng ating patient is about the breast, you have to properly assess this one. Now, ano po yung mga common or concerning symptoms po na pwede pong sabihin ng ating patient that you really need to assess their breast? So first is mag-report po siya ng breast lump or breast mass. Lumps may be a physiologic or pathologic ranging from cyst and fibroadenomas to breast cancer. So, pag cyst po, merong fluid filled yan siya, pwede po siyang benign or malignant. Now, pag usually common po yan yung mga cyst is medyo on the side of benign. And then, pag fibroadenomas naman, that is closer to malignancy. So, another is breast pain or discomfort. Normal po na sumasakit po yung ating suso pag nasa atin po, lalo na sa mga babae, pag nandito po yung mens po, normal po or papalapit na. Pero kung wala yung mens, everyday, nararamdaman mo na masakit talaga, so that's abnormal. It's a early sign po na baka po may breast cancer kayo. And also, nipple discharge. Commonly po, if you're not lactating, meaning hindi po kayo nagpapasuso ng bata, dapat wala pong mga discharges dyan. No? Milky bilateral discharge or galactorrhea may reflect pregnancy. Pero pag hindi naman pregnant yung babae, this may reflect na merong other hormonal imbalance or meron po siyang imbalance sa kanyang prolactin. Remember po, ang ating prolactin, sila po yung hormone na tumutulong po sa suso para po magkaroon ng milk production. Another is non-milky unilateral discharges which suggest a local breast disease. Example, may nana, okay, or may biglang lumalabas dyan na tubig-tubig na it's either mabaho or walang amoy. So, pwede pong may breast disease ang ating patient. So, palpable masses of the breast. So, 15 to 25 pero 15 to 25 years old po, pag may makapa po kayong mass, baka common lesion po yan is yung mga fibroadenoma. So, this is usually fine, round, mobile, and non-tender. Pag umabot na po kayo sa edad na 25 to 50 years old, ang common lesion na pwede pong makapa if ever po merong mass dyan is may cyst, may fibrocystic changes, or cancer. Usually po, soft to firm po ang or round and mobile po, and often tender ang cyst, no? Movable po siya. Pag nandoon po na tayo sa cancerous or cancer na mga tumor, it is non-movable, it is nodular and irregular po yung kanyang shape, no? And clearly delineated from surrounding tissue. Para makikita mo talaga nakakaiba po siya doon sa specific na area ng kanya, overall ng kanyang breast tissue. For over 50 years old, the cancer the cancer until proven otherwise. So the same din po ng kanyang characteristic, the same pregnancy and lactation din po. Okay? So, mga pregnant woman, baka common lesion if ever po may mass that may be caused by a lactating adenomas, a cyst, mastitis, or a cancer. So, what are the risk factors po? Ano po yung mga factors na pwede pong makadagdag sa patient po natin na pwede pong makakuha ng breast cancer? So, breast cancer is the most common cause of cancer in the woman worldwide, accounting to 18% of all female malignancies. As we age kasi at makapunta na po tayo sa edad ng menopause, because of the poor production of estrogen, I think na-mention ko to sa inyo sa class, na nagkakaroon po ng problem sa ating reproductive organ. So, we are at risk of developing certain cancers kasi nagkakaroon po ng changes na hindi po ma-regulate or ma-maintain yung function ng inyong reproductive organ because of the poor regulation ng ating hormone. More than 12% a lifetime risk of developing breast cancer. So, it is actually a type of cancer. Pag po yung cancer, basta any type of cancer, it is pag meron pong cancer na nagkaroon ng cancer sa family niyo po, you have to make sure na or you have to accept na at risk na po kayo in developing any type of cancer because cancer po is a family history disease, no? It runs in the bloodline. So if ever po meron kayong relatives, okay, or immediate family na nagkaroon ng cancer, you have to accept na at risk na po kayo at kailangan maging careful na po kayo. Approximately 20% risk of dying from the disease. Again po, ang cancer, treatable po yan siya if early po siyang nadadiagnose. Pag late po siyang nadadiagnose, then mahihirapan pong i-treat yung sakit. And 70% no known predisposing factors, definite risk factors are well established. So, this includes the age, family history, a relative risk of breast cancer. Another is the menstrual history of the patient, pregnancy, breast condition and diseases, risk from familial breast cancer, family history of breast cancer or genetic predisposition. Also, sa menstrual history po, baka sabihin nyo, bakit kasama po? Pag meron pong early menarche or delayed po yung menopause, this can lead actually and this may be a risk factor that may lead to breast cancer. First live birth after age of the 35 or no pregnancy all raise the risk of breast cancer 2 to 3 folds. Kaya po dito sa atin, 'di ba, we advise po na hindi po masyadong matagal mabuntis ang isang babae. I mean, yung age po niya. Kasi pag umabot mo po ng 30 years old above, at risk na po yung pregnancy ng isang babae. For the breast condition and diseases, this include benign breast disease with biopsy findings. This may be a typical hyperplasia or lobular carcinoma. So, kung diagnose na siya previously, so pwede, kahit sabi niyo, ma'am, benign po siya, pwede po na pag hindi po mapigilan or hindi po ma-practice ng ating patient yung good lifestyle, lahat-lahat po kailangan every now and then na-assess niya yung sarili niya, pwede pong maging cancerous yung isang benign tumor. Breast cancer screening, this may include your breast self-examination method. So, recording the physical examination and breast and axillae. So, ito po yung mga example lang how to record. The breast is symmetric without masses, nipples are with no discharges. The breast pendulous, example lang, no? Kung meron kayong may nakapa na mass, okay? Diffuse with fibrocystic changes, single firm 1 by 1 centimeter. Okay, so ayan, nakita nyo, di ba? Upper outer quadrant at 11 o'clock para alam natin kung saan banda, no? So, what are the procedures on assessing the breast and axillae examination? So, first is inspection. So, inspect the breast and nipples with the patient in a sitting position or and disrobe to the waist. So, sitting position mas pinakamaganda po, preferably yung sitting position. Para po kasi makita talaga natin yung breast tissue. Pag kasi po naka-lie down or nakasupine po yung ating patient, lalo na po sa mga patient po na hindi po kalakihan ang kanyang hinaharap. So, talaga pong mafa-flat yan siya. So, hindi mo ma-appreciate yung breast ng inyong patient. So, you have to check. So, first is ask the patient to place their arms at the sides. Okay? So, check for the color, okay, of the skin. No? Thickening of the skin and unusually prominent pores which may accompany lymphatic obstruction. So, pag makita mo na may thickening, baka meron pong lymphatic obstruction dyan. Redness or local infection that's abnormal and thickening of the prominent pores may suggest breast cancer. Okay, so yan po yung sinasabi kong arms at sides. So, i-check nyo po talaga. Okay, another is, ito po yung mga symptoms po ng ating mastitis, okay, or inflammation of your breast. So, makikita mo na pag pina-arms at sides mo, makikita mo na yung isang breast is sobrang maga, okay, inflamed, and merong redness. So, the main symptoms of mastitis includes breast pain, swelling, redness, fever, enlargement, changed nipple. Kumbaga na iba po, pati yung nipple niya is nag-red na, no, or namaga siya. Discharges, itching, okay, laging makate, tenderness, and or breast lumps, okay? So, size and symmetry po ng ating breast. So, check po yan siya while nasa side po yung mga arms ng patient is nasa side. So, ito po yung perfect breast shape. Ayan po siya. Okay, we have the swooping breast. The sagging breast, usually common po siya nakikita pag nagbe-breastfeeding yung mother or pag matanda na po. We have large breast. Okay, sa mga matataba na pasyente. We have small breast, constricted or tubular breast. Yan, parang medyo nakatusok. Okay, we have Snoopy breast and we have pectus carinatum. Diba? Remember niyo yung pectus carinatum is a deformity sa chest area na pati yung breast din niya po nasasama po, napapasok siya. Okay? The contour of breast, you have to check for any changes such as masses, dimpling. Alam niyo yung dimpling, di ba? Yung mga dimples, no? Or flattening. Compare one side to another. Flattening of the normally convex breast suggests cancer. Kung example lang, yung breast ng patient talaga is in convex shape, pero nagpa-flatten siya, that may signify na may cancer po. Suggestion lang po yun, but we have to check pa rin po na talaga bang merong cancer. So, characteristics of the nipples, the size and the shape, direction in which they point, you have to check that one kasi may mga nipple po na hindi po naka-point outward. Meron pong nasa loob, no? So, you check for any rashes, ulcerations, or any discharges. So, abnormal can be asymmetry of directions in which nipple points suggest underlying cancer, rash or ulceration, and Paget's disease of the breast. So, yan po yung Paget's disease, no? Inflamed po yung, and red po yung kanyang nipple. So, yan po, pag may sakit pong ganyan yung pasyente, nagpapasuso siya, hindi po pwede. Again po ha, pag meron pong mga infection ng ating patient sa suso at he or she is breastfeeding, kailangan pong mag-stop ng breastfeeding ang ating mother kasi kawawa po yung bata. Okay? So, recent or ito po yung sinasabi nating flattening. Makikita mo 'di ba yung isa convex, ito medyo flat siya. Recent flat or recent or fixed flattening or depression of the nipples. Ayan po yung nipples niya, flattened siya or depressed. So this may suggest nipple retraction. A retracted nipple may also be broadened and thickened. Okay. So yan po yung tinatawag nating inverted nipple. Yan po points out inside, inward po. The nipple is inverted or depressed below the areolar surface. A long-standing inversion, a normal variation with no clinical consequences except for possible, sabi nyo, ma'am, okay lang po yan. It's okay, pero pag yung mga nagpapasuso po, hindi po nila kayang magpasuso ng baby kasi inverted po yung kanilang nipple. So, ito naman po yung sinasabi nating retracted nipple, no? Naka-sideways. So, imbes na nasa sideline, okay? Middle, no? Medyo retracted yung kanyang area. Papasok yung isa, no? Ayan. So after the arms at the side, now you ask the patient to place their arms over the head, no? And another is after over the head, and then ask them na naman yung hands, it's pressed against the hips, and then the last one is your leaning forward. So arms overhead. So this is to check bakit po ito ginagawa itong tatlo? Pinapataas natin yung kanilang kamay over the head, pressed against the hips and leaning forward para po ma-check if ever meron pong dimpling or retraction or may otherwise na invisible po yan siya. So ask the patient to raise over her head and press against her hips or to contract the pectoral muscles. Now to check or inspect the breast contours carefully in each position. If the breasts are large or pendulous, yung mga biniyayaan na malaking dede, it may be useful to have the patient stand and lean forward, supported by the back of the chair of the examiner's hand. So, yan po yung sinasabi kong arms over the head. Doon nyo po din makikita kung sabay po na tumataas din yung suso and then symmetric yung kanyang movement. When a cancer, kung meron pong dimpling or retraction ng ating breast, when a cancer or its associated fibrous strands are attached to both the skin and the fascia overlying the pectoral muscles, the pectoral contraction can draw the skin inward, causing dimpling. Kaya po, mag-suggest po, dimpling po or retracting of the breast, may suggest po talaga na merong cancer. Again, suggestion po. So, ito po yung sinasabi kong dimpling, katan. Na plasak, okay? Medyo dumidiin yung isang part or a significant part of the breast. So, ito po yung sinasabi nating hands pressed against the hips. So, check nyo din po yan siya for the if ever may mga lesions, okay, and then merong mga abnormal movement. So, benign lesions may include post-traumatic fat necrosis or mammary duct ectasia. And then leaning forward, ayan po sa mga malalaki yung dede, yan po yung maganda din para ma-check po natin if ever may mga lesions. Okay, this may reveal asymmetry of the breast or nipple that is not otherwise visible during the first na procedure, which is yung arms niya is nasa side lang. Retraction of the nipple and areola may suggest an underlying cancer. For now, the palpation. So, the best performed when the breast is tissue is flattened. So, ang palpation po, it is best performed po pag yung breast tissue po is flattened. So, you ask the patient in a supine position. So, ito po yung tinatawag nating BS3 mnemonic, which is first is the best tissue, ang pagpalpate po is best po yan pag yung breast tissue is flattened. That's why you have to place the patient in supine position. And 3 minutes of thorough examination for each breast. You have to use your finger pads, not po yung fingertips. Finger pads po of the second, third, and fourth fingers, keeping the fingers slightly flexed. Okay. So, palpation, it should be systematic. It can be a vertical strip pattern, which is the best validated technique for detecting masses from a vertical strip. Diba? Ano ba yung vertical? Ito po ay horizontal. Ito ay vertical. So, pag ganun, no? na pag-assess. So, apply light and medium and deep pressure. You will need to press more firmly to reach the deeper tissue of a large breast. Kung malaki po yung dede po ng ating patient, kailangan mas deeper po yung pagpapalpate natin. But we have to make sure na hindi na po nasasaktan yung ating patient. Again po, wala pong, dapat po yung paghawak po natin sa ating breast ng patient is wala pong mali siya. Hindi ka po makikitaan na meron pong mali siya sa ginagawa mo. Your examination should cover the entire breast, including the periphery, the tail, and the axilla. To examine the lateral portion of the breast, okay, sa side, no? Ask the patient to roll onto the opposite hip, okay, and place her hand on the forehead, but keeping the shoulder pressed against the bed. So, naka-side lying siya, pero nakaharap yung dede sa'yo. No? Just to check lang if ano yung sa side, lateral portion ng kanyang breast. So, ito po yung tinatawag natin na assessment. So, yung papasok, okay, magsa-start ka sa labas. Okay, dito yung first is dito sa surrounding and then papunta sa vertical. So, yan, kakapain mo yan siya. And then, dito naman, ito po, ayan, no, I think this is the vertical one. Sorry. Oh, yes. This is the vertical one. Horizontal pa ganun pala. Okay. So, ayan. Okay. Pwede din na i-ganito mo, tapos i-ganon mo. Or pwede din na paisa-isa by line. Or pwede din circular motion. No? Paganon, 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 paganon. Hanggang sa nauna ka sa nipple. Okay? Begin palpation in the axilla, moving into the straight line, down to the brow line, and then move the fingers medially and palpate the vertical strip up to the chest to the clavicle. Continue in vertical overlapping strips until you reach the nipple and then reposition the patient to flatten the medial portion of the breast. So abnormal findings may include nodules in the tail of the breast. This may be these are sometimes mistaken for enlarged axillary lymph nodes and vice versa. Again, nodules po yan. You have to identify what is a nodule and what is a lymph node po. Ang lymph node po kasi is non-tender, hindi po siya masakit paghahawakan, and at the same time, movable po yan siya, and very small po siya. Unlike po sa mga nodules, medyo malaki po siya compare sa ating mga lymph node. So, ito yung sinasabi ko, no? Nagsa-start ka sa kepet, okay, down, and then pag ganyan, and then hanggang sa maabot ka sa nipple. And then pag dumabot ka na sa nipple, pataas na naman, dito na naman sa gitna, no? To examine the medial portion of the breast, ask the patient to lie with her shoulders flat against the bed or examining table, placing her head at the neck and lifting her elbow until it is even to her shoulder. So palpate in a straight line down to the nipple, to the bra line, and then back to the clavicle, continuing in vertical overlapping to the mid-sternum. Ito po yan siya. Ayan, no? So, examine the breast tissue carefully for consistency of the tissues. Normal consistency varies widely depending on the part of the relative proportions of the firmer glandular tissue or yung soft fat. Physiologic nodularity may be present which is increasing during or before menses. Kaya ba sabihin nyo na parang ma'am, parang may nakakap akong matigas dito pag meron akong mens. Normal po yan siya. That's a physiologic nodularity. Pero abnormal po yan siya if hindi naman po kayo may mens. So, meron kang nakakapa dyan and then, may pa-mens ka man or wala, andyan pa rin siya. So, that's a problem. So, there may be a firm transverse ridge or of compressed tissue along the lower margin of the breast, especially in the large breast. This is normal inflammatory ridge and not a tumor. Normal po yan siya sa mga malalaki yung dede. Pero pag sa maliliit yung dede niya, this may signify na may cancer. Tender cords suggest mammary duct ectasia or a benign but sometimes painful condition of dilated ducts with surrounding inflammation, sometimes with associated masses. So, ito po yung tinatawag nating mammary duct ectasia. Again, it is a benign, a painful condition of the dilated ducts. Yung inyo pong mga milk ducts, dilated po siya, na nag-inflame po siya, na magapo. Sometimes associated with masses, may tumubo na po ng mga mass sa loob niya. Yan po yung ating mammary duct ectasia. So, you have to also examine the breast tissue for any tenderness. So, meron po tayong tinatawag na premenstrual fullness. Yan po. Normal po yan siya. Pag before po mag-mens, okay, medyo parang mabigat and then masakit yung dede, that's normal po siya, no? Pero yung mga tenderness po na form na hindi naman po mens or kahit may mens or wala, nandoon pa rin, that's abnormal po. No juice, palpate carefully for any lump or mass that is qualitative, qualitatively different from the or larger than the rest of the breast tissue. So, assess and describe the characteristic of any nodule if ever meron po kayong makapa. You have to first check or assess the location. Yun na nga po, you have to divide imaginary yung ating breast tissue in a 4 quadrants and then make sure na parang nasa clock lang tayo. So, with centimeter from the nipple. So, pag, doon, example, na-assess mo na dito sa 11 o'clock. So, you have to measure ano yung distance niya papunta sa nipple. 10 centimeter away, 2 centimeter away from the nipple. Yan. The size in centimeters. Shape, is it round, cystic, disc-like, or irregular in contour? Consistency, this may be soft, firm, or hard. A hard, irregular, poorly circumscribed nodules and fixed to the skin and underlying tissue strongly suggest po na may cancer ang patient. Specifically, breast cancer. Now, so for the delimitation, well circumscribed or not. Tenderness, mobility, in relation to the skin, pectoral fascia, the chest wall. Gently move the breast near the mass and watch for any dimpling. Assist inflamed areas may some cancer may cause tender or dimpling. Okay? So sa nipple naman po, palpate each nipple, noting its elasticity. So, take note if ever pag pinapalpate nyo po is meron pong lumalabas na discharges. Normal po na may lumalabas na discharges sa isang lactating, meaning nagpapasuso po na babae, pero abnormal po siya sa hindi po nagpapasuso na babae. Thickening of the nipple or loss of elasticity may suggest an underlying cancer. Okay, so I think that ends my discussion for assessing the female breast. Let's continue the assessing the breast, discussion of assessing the breast and axilla in the class. Okay, once we will have our face-to-face na so we will discuss direct no sa ating male breast. So please do study po because before I will discuss the male breast, magbibigay po ko ng short quiz regarding po sa diniscuss natin na male reproductive assessing of the male reproductive system and assessing the breast female breast and axillary. So thank you for watching and have a nice day.